Accessing psychological support can feel a bit like navigating through a maze. There are lots of supports out there, but it can be hard to know where to start.
Yeah, there's no right or wrong answers. Sometimes you just have to make a list and find a place to start. And if you're not sure, reach out to someone you trust and see what they think's the best approach. Cancer impacts on both your physical and emotional health. And we sometimes bottle up our emotions and we don't talk about them. But we know from both clinical experience and research that the majority of people at some stage during their cancer experience will have significant emotional distress and will need a little bit of extra support.
Often your usual coping strategies and support of family and friends can be helpful in managing these feelings, but if the feelings are there often or they're getting in the way of your everyday activities, it might be time to think about getting further support.
The best place to start is to complete the Cancer Mind Plan on this website. It's just a series of questions that'll help you figure out the degree of distress and the options that are before you. But if you don't want to do that, you can just ask yourself, am I coping with my cancer? Am I coping with my treatment? Am I sleeping? Am I eating? Am I anxious? Just ask yourself those basic questions. And then finally, if in doubt, just ask someone you trust or even your GP and see if they think that this is a time for some extra support.
Once you've decided that you do want further help, you can have a look at the Cancer Mind Care website. It'll suggest multiple options of support to access, so make a list and have a think about which option might be right for you. You can bring this list to your GP, your cancer clinician, or just look at it with a friend or family member. Well, there's lots of health professionals who can help with finding mental health support.
I usually think the best place to start is your GP. If you have a GP that you trust and knows you well, they'll know the local services and they'll be able to tell you which ones they think will particularly suit you. And they can also write a mental health plan that enables you to access Medicare rebates for any of the clinicians in the community that are private and charge fees.
There's also your cancer clinician. They have years of experience and they know all the options for people with cancer. Your local health service will also probably have psychiatrists, psychologists, social workers, music therapists, spiritual care workers who you can access, and your cancer clinician can write a referral for you and decide with you what would be the best option for your situation.
And many of those practitioners Ella just mentioned are also in private and also in government community clinics. And remember, nearly all of them these days do either telephone, telehealth, or face-to-face.
You can also look for a health professional using an online directory. These you can search by location or by area of specialisation like oncology to find someone who meets your needs.
And finally, you can always ring the Cancer Council that have complete lists of all these services on 131120. You can start by browsing this website and you'll find a whole lot of online websites and apps that help you manage your own symptom. It's a form of self-help and they're basically interactive programs that teach you to manage your anxiety and prevent future mental health problems. Sometimes it's a good idea to start with self-help, but if that hasn't worked after a few weeks or a month, you need to go and see a clinician and speak to someone face-to-face.
If you need urgent help, you can contact your local mental health crisis support team, usually a hospital emergency department, or you can call a 24-hour helpline such as Lifeline or Beyond Blue. The main thing to remember is that there are lots of options. Explore this website, talk with your GP, talk with your cancer clinician, make a list of ideas and have a think about it, and then get started somewhere.
Yeah, and if that first option doesn't work, just go to plan B or plan C or even plan D. The main thing is to persevere. If you persevere, you will find an option that suits you and you will begin to feel better.